Hello, my name is Dr. Stephen Tourget, and I am an IATI therapist. So I want to shed some light on specifically what is therapy or psychotherapy, how do we think about it, and what does it really mean to be in therapy. Psychotherapy or talk therapy is a special type of mental health treatment that really focuses on helping you to relieve your emotional suffering through talking about your feelings and talking about problems that you might be having. And this involves a safe and trusting relationship between you and a trained mental health clinician in which you can meet with a regular frequency. Usually weekly is best because that allows you to stay up on whatever's going on in your life and to not have to be catching up and reporting back. Therapy is about vulnerability, being vulnerable with the clinician and being able to bring in genuine material into the sessions. It's about being consistent and driven and motivated for the sessions so that you can get the most out of them. It's also about bringing in the true version of yourself, being honest with yourself and thinking about how you want to work on identified goals with your therapist. It's about showing up, being consistent, coming in every week so that you actually can make real progress. What it is not. Therapy is really not about just chit chat or small talk. You really want to go beyond that. Therapy can be ineffective when you feel judged or it doesn't feel like a safe place where you can go to really talk about your feelings openly. Therapy is not just getting advice and being told what to do in your life. It's about building effective coping skills and being able to expand upon that and use those coping skills in a way that's going to help you make progress in your life. So if you expect that you're just going to show up to the therapist and be told, hey, this is the solution to my problems, that's not going to necessarily be very accurate. It's a process that is back and forth and is iterative in the sense that you build off upon the previous sessions to grow and expand. What are some of the barriers to actually seeking care and getting started with individual psychotherapy? Well, some people just don't believe that talking about their feelings or problems will actually make a difference or lead to any positive change. But you actually have to change your attitude and be willing to engage in a special type of treatment that's going to focus on these issues. And if you don't start with a positive sort of sense of what could take place in that transformative journey, then you're going to be potentially self-sabotaging the treatment. So it really requires an open sort of stance and a willingness to commit to getting better. You really have to engage in it and be willing to work with your therapist on certain issues in order to make that progress. And if you're not willing to try or you're unmotivated, that can make it very difficult. Just like if you had a fracture or some other type of medical issue, you would want to seek treatment from a trained physician or trained clinician who's going to diagnose and then treat. Just like in therapy, you end up diagnosing the problem and having treatment based on that diagnosis. So give your mental health the same dedication and care that you would give other medical issues that you might have. Some people just want to take a particular pill and get a quick fix to problems that have really been going on for years. And they expect that by talking with a person once or putting in a little bit of effort that they're going to be able to overcome a lot of these long-standing issues. But the thing you have to realize is that therapy is work. It takes work on the part of the patient and on the part of the clinician working together to be able to make real change. It's a process and you'll get there. You might feel uncomfortable initially, but over time you should feel a little bit more of a therapeutic alliance and connection with your therapist. It's really a great process, and I think it's a difficult question to answer. It's one of those things that you just kind of have to do, kind of like what is riding a bike. You just kind of have to do it and understand it and experience it and take it from there. I really think that psychotherapy can be useful for many different people if it's understood properly by the person seeking treatment and if you find the right therapist that meets your needs.